Hi, I'm John Genrich, pediatrician. The study of how marijuana affects moms, their unborn babies, their newborns, their breast milk, and their older children is an ongoing science. What we know so far. Today, the marijuana processed for recreational and medical use is much different than that of a few years ago. The marijuana of today is much more powerful and toxic than that of a few years ago. In the past, it was 3% THC. Now it's 11% THC. Many of the studies that started 20 years or more ago have been ongoing, but they're based on the weaker marijuana that was used in the past. Studies are ongoing to monitor the effect of occasional marijuana smoking moms. There are a few things to think about. Number one, ingesting marijuana gives higher blood levels than smoking it. Number two, if a pregnant mom smokes 6 marijuana cigarettes per week, her unborn child has a greater chance of being born too early, being stillborn, having a hole in the heart, having a smaller than normal brain, having fewer than normal nerves that connect in the central nervous system. Number three, if a pregnant mom smokes more than 6 marijuana cigarettes a week, when her child is older, he or she will have a decrease in his or her response to light at 18 months, sleeping problems, more muscle tremors, decreased startle reflex, will be shorter than expected, and more aggression if the child's a girl. Number four, if a pregnant mom smokes more than 6 marijuana cigarettes a week, her child will have less memory than other children at 4 years of age, be less verbal than other children, have more hyperactivity than other children, be more impulsive, will not sleep as well as other children, will have lower intelligence than other children. Number five, if a pregnant mom smokes more than 6 marijuana cigarettes a week, when her child is a teenager, he or she will have fewer inhibitions than other adolescents, less than normal working memory, more than expected depression, hyperactivity, and delinquency. Nursing moms who smoke marijuana should know the facts. Number one, with alcohol, the drink, pump, and dump may sometimes be helpful to some, but with marijuana use, smoking or ingesting and then dumping the breast milk doesn't help the baby. Number two, the chemical in marijuana is lipophilic. In other words, it's attracted to the fat content of the breast milk and can stay in breast milk for 2 weeks. If you're using 1 marijuana joint per day while nursing, the amount of marijuana chemicals that are passed to the baby are 8 times the concentration of that in the mother's bloodstream. Remember, the marijuana chemicals like to be attached to the fat in mother's breast milk more than they like to be attached to the mother's bloodstream. Number three, moms who nurse and use marijuana have infants that have poor sucking, muscle tone that's less than other infants, slower growth than other infants, lower psychomotor abilities, and a higher rate of dying from sudden infant death syndrome. Every pregnant mom and every nursing mom should know about these things and consider them each day as they look into the eyes of their child. As stated earlier, these are the facts, but these are facts that are often based on the earlier, less potent marijuana than what is available today. There's more to come. Thanks for listening.